When it comes to testing for COVID, we have drive-up sites, home tests, and rapid tests. But now there's a new one that tests for more than 20 different respiratory illnesses. Knowing which one you have determines the course of treatment. CBS 12's Lily Ortiz spoke to one doctor who explains how it works and how much it'll cost you.
Typically, doctors administer tests and sick patients are forced to wait days for results. This leaves doctors with very little information for treatment, and delays can impact recovery. So the one doctor we spoke with has this new test that with just a nasal swab, it can test for more than 20 different respiratory illnesses, and the results come back right away. You walk inside Good Samaritan Medical Center.
We've already swabbed the patient.
Similar to a PCR test, lab technicians collect a nasal swab from a patient experiencing symptoms and inserts it inside a machine. This pricey machine that resembles an office printer, it quickly identifies dozens of health-threatening outbreaks in one visit in less than 2 hours.
And we were the first private practice in South Florida to have it up and operational.
Internal medicine and infectious disease specialist Dr. David Dodson calls it a game changer.
There have been individual tests, but when you can have one test and it gives you an answer that you can act on clinically, that's the game changer part of this. It's really remarkable.
It's called QIA Stat Respiratory Panel. It reveals negative and positive results for 21 different respiratory viruses, infections, and bacteria. It can detect at least 4 coronaviruses, including COVID-19.
I mean, we've been able to test for influenza individually, and we have a test for COVID individually, but this is one swab, and then in 2 hours, we have an exact diagnosis of what virus it is, whether it's COVID or not.
It does not test for the highly contagious Delta variant because that requires further testing.
It requires a more sophisticated lab to do the genetic analysis to tell you whether it's Delta or other variant.
In this newly released CDC report, experts recommend that doctors move forward with this sort of testing.
I think all hospitals, all ERs, all urgent care centers should really have one because it really changes how you practice clinical medicine.
Now they charge about $300, but we made some calls and we found out that the test is available for both group and individual uses, and it's covered by some insurance companies. In West Palm Beach, I'm Lily Ortiz, CBS 12 News.